How's everybody doing? My name is Matt Young. I'm president of the American Academy of Implant Dentistry. Today we're talking about our annual program in Phoenix, Arizona. It's going to be a great conference with main podium presentations, live hands-on workshops, camaraderie, credentialing. It's going to be an awesome time. Today we're very honored to have Dr. Suheil with us today to talk about his presentation on the main podium. Dr. Boutros is a board-certified periodontist, teaches at University of Michigan, and also a very successful private practice. He's also the media past president of the American Board of Oral Implantology and a fellow of the AAID. He's been very involved with the organization over the years, and his lectures are always amazing, and we're very happy to have him present this year. His main podium topic is going to be hard and soft tissue management around implants in the aesthetic zone. Dr. Boutros, thank you very much for being with us today and taking time out of your busy practice.
Thank you, Dr. Young, for the kind introduction. And I am looking forward to be part of the annual meeting. It's a very exciting time. I'm honored to be presenting on the main podium as a periodontist and an implant specialist. I will be covering the implant in the aesthetic zone and the management both of the soft and hard tissue. So I would invite all of you to join us at the annual meeting. Looking forward to connect with colleagues and share and learn about the most modern innovation in implant dentistry.
That's great. You know, your presentations are amazing, and you're able to break down very complex topics with regeneration, flap design into some things that our attendees can understand. You know, we have implants in the posterior, single implants in the posterior, and then we have implants in the anterior. If we want to be successful in implant dentistry, anterior implants is really essential. What are some of the things that you'll talk about to help them bridge these hurdles of the anterior aesthetic zone?
It's a great question. Modern implant dentistry not only rely on bone and osseointegration, but it will also depend on the soft tissue integration in the aesthetic outcome. And the presentation will go over the decision tree in making the appropriate decisions for both soft and hard tissue augmentation, the treatment sequence, and I will be discussing the timing of soft tissue surgery prior to implant placement, at the time of placement, and following the final restoration to enhance not only the aesthetics, but also to predict the long-term success of the implant. Because as we know, peri-implantitis is a hot topic, and it will be discussed in detail on Saturday at the annual meeting. But part of the concern we have with peri-implantitis is the lack of soft tissue. So that's where I will be showing some cases on how to manage soft tissue, not only from an aesthetic standpoint, but also from a management of perhaps future peri-implantitis that could arise due to lack of soft tissue.
Well, yeah.
Go ahead.
It's going to be an awesome presentation because, you know, we want to be able to manage and maintain our patients long term, and when problems arise, we want to be able to have the tools ready to do this.
That's exactly what it is. As we said, over the years, we learned bone is very important for the function of the implant, but aesthetic integration, the soft tissue management is very critical, because especially in the aesthetic zone where patients trust us as clinicians to deliver, and that's where it's very important to address and train our colleagues on soft tissue management beside the bone grafting and bone augmentation.
That's awesome. I'm pumped. I'm excited for your lecture, and you know, I always come away with so many things I can implement into practice.
Thanks, Dr. Young. I'm honored and invite all our friends and colleagues to join and that's regarding the main podium. Following the main podium, I will be doing the hands-on workshops. So I encourage all of you after the main podium presentation to sign up for the workshop, as we will be demonstrating the soft tissue surgery, the connective tissue graft, the free gingival graft, the allograft on a specimen, on a pig jaw, and we will also be demonstrating the socket management following extraction, and how do we do our socket preservation and ridge augmentation on the pig jaw as well.
It's going to be amazing, to be able to do a hands-on program like this. This is one of the great things about our annual meetings, is that you get that clinical approach and clinical feel by experts like Dr. Boutros in his field on periodontics, soft tissue management, bone grafting. That session on pig jaw is going to be spectacular. And to be able to see the lecture one day and do the hands-on program after that, I think it's an amazing pairing.
Looking forward to it. Looking forward for the interaction with the colleagues, and hopefully we can deliver the message about both soft and hard tissue management in the aesthetic zone, and to be followed by the workshop.
That's awesome. You lecture all over the world. You're world renowned and in high demand. Why do you take time out of your schedule to work with the AAID and meetings like this?
The AAID means a lot to me. I made a lot of friends over the years. I shared knowledge, and I learned a lot from great experts in the field. And being a past president of the ABOI, I witnessed firsthand how well trained the dentists and the members of the ID. And when they showcase their cases during the challenging of the ABOI, it makes me feel very proud of this organization and this group. And as I said, contributing, sharing knowledge, and learning from others, there's no other words to describe it, but just being humble and very grateful for the friendship and the membership at the ID.
Thank you very much, Dr. Boutros. We've benefited from you over the years, not only your expertise, but your friendship and your camaraderie, and the spirit to keep on going and keep learning. And we really appreciate you being at the meeting and presenting and contributing so much.
Thanks a lot, Dr. Young. Looking forward for a great, successful meeting. Come on, join us. Looking forward to see everyone in Phoenix in November.
Awesome. AAID Phoenix, November. It's going to be awesome weather, awesome conference. Can't wait to see everybody. Have a
Way
good
to go, AAID.
All right.